Your face says 40. Your hands say 65. That's the problem. When we talk about aging, most of the attention goes to face, but the hands age at the same pace and they are always visible. When you rejuvenate the face, that gap becomes much more noticeable. The hands start telling a different story than the face. Here is what happens to hands as we age. Three things break down simultaneously. First, you lose volume. The fat pads between the tendons disappear and you start seeing every vein, every tendon. Second, the skin itself changes. It thins out, loses elasticity, develops that crepe-like texture. The third, pigmentation, builds up sunspots, age spots, uneven tone. Now here's the key. These three problems feed each other. That's why treating just one never looks right. This is exactly how I approach it in my practice. I don't treat hands as three separate problems. I treat them as one aging process. For volume, I use fat grafting, taking your own fat to restoring that beautiful fullness between the tendons. The result is something no filler can replicate because it's your own living tissue and it lasts. For skin quality, I use CO2 laser, the most powerful tool we have for resurfacing. It rebuilds collagen, tightens the skin, and transforms that thin, aged texture into something you can actually feel the difference in. And for pigmentation, the spots that makes hands look decades older than they are, I use targeted laser treatments like IPL to clear them completely. When you combine all three in one treatment plan, the transformation is remarkable. The hands finally match the face. And if you are already planning a facelift, this is worth thinking about. The hands and the face can be addressed together. Same recovery period, same process. That's something worth considering if you want the overall results to feel complete. If you look at your hands right now and you see prominent veins and tendons, if the skin feels thinner than it used to, or if you are noticing spots that weren't there 5 years ago, you are probably a candidate. And if you are already considering a facelift, this is exactly the conversation you should be having with your surgeon. This is the kind of detail that separates a good result from a complete transformation.